Is there a technique to develop patience? How can it be activated? Recall the method used to develop awareness of sensations. The process that can be applied to improve patience is more or less the reverse process. If you shift your attention to sensations, your awareness of the body will shift to awareness of sensations. Similarly, when you shift your attention to the body, awareness will shift to the body. This provides a practical way of activating the skill of patience. Remember that all physical pains are related to a particular place in the body. When you shift your attention to the appropriate place of the body, you will feel the parameters related to the body, and therefore the pain sensation will not get the same level of attention. As you have already acquired a reasonable level of skill in focusing on the body, the task is not that difficult. For example, if you experience discomfort in your knee while sitting, instead of allowing the mind to remain completely focused on the unpleasant sensation, you can deliberately shift your attention toward the physical location of the knee. You can become aware of the physical characteristics of that part of the body rather than allowing the unpleasant sensation to dominate the entire field of attention. Undoubtedly, the pain sensation will still be there, but it will not be powerful enough to generate a strong emotion. Please remember that development of patience is not defined by the absence of pain. Patience will always be associated with pain. If there is no pain or discomfort, there is very little opportunity to demonstrate or develop patience. Therefore, the objective is not to make the pain disappear. The objective is to develop the ability to remain patient while the pain is still present. As the technique is not dependent on the nature of the pain, it can control different types of pain sensations. As meditation on the body includes techniques to carry out most of the daily activities, such as walking, eating, and so on, while being patient. You can carry out most of your routine activities as well. This is important because the skill should not remain limited to a formal meditation session. The ability to remain patient can also be applied during ordinary activities of daily life. For example, you may experience discomfort while walking, standing, sitting, eating, working, or waiting. The same principle can be applied during these activities. Actually, it is to be further noted that awareness of sensation, as well as awareness of the body, operates on the physical location of the body, which is different from the image created in the brain. Therefore, distortions that take place due to neural connections, which are not rare in reported pain sensations originating at the brain level, cannot mislead the person. As an example, pain in the heart, interpreted as pain in the hand, is associated with two pain sensations. Awareness of sensations will identify the discomfort feeling at the heart, and awareness of the body will address the heart. This will reduce the discomfort feeling because the pleasant feeling related to developed awareness will arise there. As a result, the signal sent to the brain will also get diluted, and most likely some relief can be felt in relation to the pain in the hand as well. However, as the processing of information is still active at the brain level, occasionally emotional outbreaks could still take place. This is an important point to remember. Developing awareness and patience does not necessarily mean that every painful sensation or every emotional response will disappear. The purpose is to develop a greater ability to recognize the sensation, understand what is happening, and prevent the sensation from automatically producing a powerful emotional reaction. In this way, awareness of sensations and awareness of the body can work together. Awareness of sensations helps us recognize what is happening, while awareness of the body provides a way of shifting attention away from the developing intensity of the unpleasant sensation. Patience then provides the necessary support to remain with the experience without immediately reacting to it. So, patience should not be understood simply as an instruction to bear the pain. It is a skill that can be systematically developed and applied. The next time you experience an unpleasant sensation, try to recognize it before it becomes overwhelming. Notice the sensation. Notice where it is occurring. Instead of immediately reacting to it, try to remain patient. Then, when appropriate, deliberately shift your attention towards the corresponding part of the body. The pain may still be present, but the emotional reaction to it may become less dominant. With systematic practice, this ability can gradually become a practical skill that can be used not only during meditation, but also during many ordinary activities of daily life. We have therefore seen how emotions associated with pain can develop, and how awareness and patience can work together to reduce the intensity of the emotional response. But there is another interesting situation. In the examples we have discussed, we are able to identify at least something associated with the emotional response. We can recognize the pain, identify a sensation, or identify a particular location in the body. But what happens when an emotion suddenly appears and we cannot identify what caused it? Sometimes we may suddenly feel uneasy, frightened, irritated, sad, or emotionally disturbed without being able to identify any clear external event or physical sensation responsible for it. Where does such an emotion come from? Why can an emotional response sometimes appear when its cause is not immediately identifiable? This will be the subject of our next talk. In the next talk, we will examine emotions associated with unidentifiable causes and consider how awareness can help us understand what may be happening when the source of an emotional reaction is not immediately apparent. Thank you for listening.